Hi, I'm Jerry Rosenberg from Jacksonville, Florida, and I am a 7.5-year transplant survivor. It's very important for me to be here today and share my story to let everyone know that you have a second chance at life. Don't give up and do whatever you need to do to keep going and fighting for your full recovery. I feel like I'm the Lone Ranger. So many people I've met have had long journeys, and mine started on April the 4th, 2017, when I got food poisoning on a cruise to Europe. And the next morning I went into a coma, and it was that sudden. I was the healthiest I had ever been, walking 10 to 12 miles a day, and all of a sudden it hit me out of left field. I was enjoying the best health of my life. I had been on a 2-week vacation with my brother AJ in London, walking a lot. I'd been at a trade show in Las Vegas, and the week before I got sick, I felt some fatigue that I thought was a common cold or flu bug, and that was it. No other symptoms whatsoever. When I took this cruise, we were about 6 hours late leaving the port. And when we finally left at 9 o'clock at night, I made the decision, instead of going to the dining room, to go to the buffet, not realizing the food had been out all day. And I got food poisoning, and evidently that's what triggered all the events where this fatty liver that I didn't know I had could not process the food poisoning. The only warning I had that anything was going on with me was for about a week before. I'd been traveling a lot, I'd been changing time zones, and I had fatigue, but I didn't think it was liver problems. I had just had a physical the week before, and I was told to drink more water because my kidneys were a little sluggish, and other than that, I was in perfect health. All of a sudden, I went to the infirmary and found out I had food poisoning and I was going to have to get off the ship in Bermuda. I then woke up a few days later on an air ambulance landing in Fort Lauderdale and was in the hospital there, and that's when I found out from them that I had acute liver failure and I was going to need a transplant. I was shocked. I had no idea. But I fought very hard to get stronger to where I could travel back home to Jacksonville where I live and be at the facility there. Then once I got home and I started going through preparations to be in line for a liver transplant, I got very sick very rapidly and I couldn't stop coughing, and they put me back in the hospital, and they had to put me in 3 different self-induced comas not to cough to death. Well, the biggest thing for me in my liver failure was I had to be on dialysis during my surgery. And since then, I had a problem at one time where I was in the hospital and I had to be on dialysis 2 nights in a row when I was given some medication that did not agree with my kidney. And other than that, I take my medications faithfully every day and every night and watch my numbers with my blood work. My primary care physician is also my friend. So I was able to text him and ask him questions through the day because he had access to my blood work. That was before I was on the hospital portal to be able to look at it myself. And every day, so many physicians and students came in. And when they would make their rounds, there would be 8 or 10 doctors at a time around my bedside. And I can't even tell you who I interacted with. There were so many. I was affected before the transplant by not knowing if I was going to survive and how sick I was. And I was thinking that the liver rejuvenates itself, so maybe I don't even need a liver transplant. I just did not know what was going on. I'd never known anyone to have a liver transplant, and it was very frightening. I had a hard time when the doctors and nurses came in. I had a hard time concentrating. I had a hard time remembering. So a lot of times if my brother wasn't there, I would call him on the phone and put on speaker so they could hear them firsthand, or else I would ask them to write it down so I could show it to him when he got there. And of course, the medical staff was wonderful. So when AJ would arrive, they would go over everything with him because my mind was in left field. So I could not be responsible to repeat things. I don't think I was any part of the decision maker. Luckily for me, my brother was my caregiver, and I had a couple of friends that were involved with him. And I'm sure when the decision was made, I was probably in a coma. I think it's probably more of a question for my brother because I was in a coma, but from what I understand, the insurance company had not approved it. And I had a friend that was friends with the vice president of the insurance company, and she got in touch with that person, and they said, well, we don't have the claim. Have the hospital resubmit it, we'll approve it immediately. And they did, and I was put on the list that Friday afternoon, and then my brother got the call that Sunday morning that they had a liver available. And of course, I didn't have to be like so many other people that have to hurry up and get right back to the hospital because I was already there. It was unbelievable, the speed of it. Well, I know my brother was very concerned, wanting to know if I was going to survive or not. I was along for the ride. Being in and out of comas and being so sick, I really wasn't aware of what was going on. I remember being brought out of a coma right before they took me into the operating room with my loved ones around me. And then I remember the next day waking up and my brother telling me I had had the liver transplant. I didn't even know it. There were a lot of tubes coming out of a lot of different parts of my body, and I wanted to get those out immediately. And I guess I tried, and they had to tie my hands down and put these mittens over them so I couldn't do any harm to myself, and that was hard. And the more I thought about it, I just thought, well, every minute I'm 1 minute closer to recovery. And I started having a very positive outlook. The first time I think was 2 years ago when I was at the Global Liver Institute in Washington, and actually a name for it. I was not really informed of anything. It was just, I was more or less in shock that I went from being so healthy to being bedridden and near death's door. Even afterwards, it took me a while to realize everything I had been through and was going through. And then it was more recent than that when I first started talking with Dr. Addy that I always felt like I was the only person that had something like this hit them so fast and so hard and furious that I had no warning whatsoever. And now I find out that this has happened to other people. I didn't know anything about it. I didn't know what was going on. I didn't know what had happened to my body overnight that I went from being a healthy person to being bedridden. I was really in the dark, and maybe my brother knew more from the doctors, but all I kept knowing was every day someone would come in 3 or 4 times a day and ask me about my alcoholism. And I would tell them, hey, I never drank. I maybe had 2 or 3 glasses of a sweet wine a year. I'm not a drinker. I never liked the taste of alcohol or beer. And that's not me. And then I find out later on that everyone that visited me in the hospital was taken outside and questioned by the nurses about my alcoholism. And that's a stigma that I think's not fair. I think for me to to hear from doctors, from physicians is very important, but also to hear from my peers of what they have experienced is very important. Being involved in the support group has really helped, talking to other people that have been through transplants like I have, and now here later on with finding out that there are other people, such as the other patient I heard from earlier today, that had it very sudden like me with no warning. And this is something that's important to me. There has got to be testing in the future where people can find out in advance if they're prone to this and know to keep an eye out on it with their doctor. No one ever mentioned a clinical trial to me, and like I said, I was in and out of comas, but no one ever mentioned anything like that. If I could not have received a liver transplant, I would have participated in any and every clinical trial available to me. Anything to help me and anything to help future generations. I believe in it 100%. My hopes are in the future, patients would be able to be part of clinical trials that could help them and do anything to keep them alive until an organ is available. Education is most important. We need to be educated on what we're going through, what we can expect, what's a best case scenario, what's a worst case scenario. Our caregivers need to know what we're going through and what they need to do and what they can expect. And even at the hospital I was at, my brother was not good enough to be my caregiver. There had to be a backup caregiver. So if for any day he couldn't get me to an appointment or take care of me, there would be a backup person to do that. And I just feel like more information would have been helpful. But going back to what I said previously, the most important thing would be is if there was more testing that was done when you have your yearly physical to really see the condition of your vital organs. I feel that everyone needs to be judged and medically supervised as an individual. Patients need to have tests done, but to be taken at their word. Someone like me that never drank, to keep being questioned over and over again about alcoholism, where they're clearly telling me they don't believe me because if you have cirrhosis of the liver, you're an alcoholic. And not even bringing up fatty liver. You know, tell me I had one too many pieces of fried chicken, but don't accuse me of being an alcoholic when I'm not. I am very lucky and be blessed to be part of these organizations that I'm involved with and to be able to be a patient advocate and to be able to try and help generations in the future not to go through all the pain and suffering that I went through, and hopefully have a head start on treatment and a head start on being diagnosed. I have a lot of messages for people, and this is the thing. Number one, don't give up hope. If you're from another part of the country or world and you're at a transplant hospital waiting for a transplant, don't say, I'm going to go home for Christmas. I'm going to go home for Thanksgiving. I'm going to go home for the holidays and then come back and get back on the transplant list. You cannot do that. You make a commitment and you stick it through because you never know when you're going to get that magical phone call. Number two, I want to thank each and every person involved with GenFit for caring enough about us, trying to give us a better life and give us survival. It's a real blessing.